really bad acne. It's very defined. That's okay. It's just being recorded, is it?
Yeah, Camille asked if we can record the session.
Oh yeah, that's fine. And but definitely I feel since the coil came out, the last time I was doing it, I would have felt that the condition of her muscle was looking clearer to me, healthier looking muscle in her back. The skin in general looked clearer, even though she still will have the old acne and probably still some new pustules popping up. But I still felt it was looking better to me. But I was just wondering where I could go with her on it. And another thing that she has had consistently, really since she moved to Edinburgh, and she's gone 6 years now, she would have very cold extremities. They just never seem to warm up. Very cold.
So,
and another thing, sorry now to cut across you again.
No,
another more recent thing is she has had very thinning hair. From
very what hair?
Her head hair has thinned. She's not losing it as such, nothing like in clumps or nothing like in circles that sometimes you'd see with alopecia. This is just a general hair loss that has made her general hair look very thin, and she would have had very vibrant. So this is a very thin hair by comparison to what her baseline would have been.
Now, I'm going to assume that Edinburgh is slightly colder maybe than Ireland, but it's really not. It's not damper, and it doesn't have much less light, even though it's a little bit further north.
Be very similar, colder, but they would be drier. But I suppose, look, maybe, and I should add in, she's just finished her clinical psychology doctorate. So
okay, so she's under a fair amount of stress.
Oh yeah, the last year would have been horrendous, and you can imagine with COVID, horrendous on the double even. So, but she did survive it, and she's now graduating next month. So all of that is good. But maybe it's part of, it won't have helped anyway, I'm sure.
And you said that once she took the coil out, the first 2 periods that she'd had were 29 days in between. Excuse me, but for maybe I should know this automatically. Does the coil prevent you from having periods? I wouldn't have thought so.
Yeah, the Mirena coil is.
It takes it out altogether, takes the period away altogether.
It does. They might get an intermittent bleed every now and again. I think it's an estrogen high. Now, I'm open to correction myself as well. I think it's estrogen high. It is a combined to a degree, but nothing like your contraceptive pill that would be combined estrogen progesterone, and they would get a period every 21 days.
Camille had a comment on that. Camille, do you know something about that?
Absolutely. So the Mirena coil is progesterone, but it's synthetic progesterone, which does not act the same as natural progesterone, as bioidentical progesterone. So it's in its own way just as toxic and just as carcinogenic as synthetic, or as any estrogen would be. And so part of the strategy here, and part of what has happened, is that it's throwing her off hormonally. It's not like just the old-fashioned IUDs that were just simply barrier methods. You're looking at a hormonal disruption here, and you're also looking at an impact to the liver, because it is a toxin. It's going to block the liver pathways that have to do with the detoxification of hormones and the conversion of hormones. All of that has gotten bollocksed up. So one of the things that we may want to discuss after we're finished talking about acupuncture is to talk about how to detox these chemicals so that she doesn't have issues down the line.
Exactly. Yeah, that would have been my concern.
Yeah, but I'll let Avi fly with it. But you're looking at liver and hormonal disruption.
So this coil. Okay. I'm just looking for a little bit extra understanding here of what this coil is. So there's a number of different, kind of so-called birth controls that are all some sort of insertion methods. Some of them are just, like literal barriers. Some of them actually, my understanding is, some of them let's say, scratch the uterine lining to produce chemical hormonal reactions, and therefore prevent an egg from being able to fertilize. They're basically disrupting the growth of the uterine lining, but it's not my understanding is that those are not chemical by nature, they're mechanical by nature.
They're mechanical. That's probably the coil you're thinking
And
about.
this one is actually, Camille, you're saying this actually injects or diffuses or whatever.
Diffuses would be a good way of thinking of it.
Actual
But your point,
progesterone.
yes, and your point is well taken that it's also creating some localized scar tissue and blood stagnation issues on a localized level because of the device itself.
Right, but the difference with this device specifically, the weird thing about this guy is, or girl or whatever it is that it's well,
it ends in A, so it's probably feminine.
Okay. Plus, it's probably a lot more attractive to women to have a feminine, a her than a him.
Of course it is. I mean, Bobby, let's not. Derek coil.
And
oh my,
whatever.
Oh my.
But the point is that this one is unique in the sense that it actually introduces a hormonal or hormonal-like substance into the body, as opposed to changing the body's own way of producing hormones.
Right.
And cycles.
It's exactly. It's like a slow
release estrogen high, really, in the main, but there is progesterone in it as well.
Okay. Now, regardless, because quite honestly, I wouldn't, I don't know if it would matter to me that exactly which hormones and all that kind of stuff. The other thing is,
could I just say?
Yeah.
Estrogen is a yin hormone, and progesterone invigorates liver qi and mildly tonifies yang.
Yeah. No, I wasn't trying to say they're not important. I'm just trying to say.
I know. I'm just providing that information in case, just in case.
Okay. Okay. Fair enough. No, that's fair. Okay. And the biggest thing about it is that it prevents, it while you have the damn thing, while you have her in you, there is no period.
Yeah, but as I say, she might get a random one maybe every 3 or 4 months, but it wouldn't probably be a true period anyway. And
that's totally normal.
Yeah.
Well, I mean, there's also the question whether the period when you're on the pill is normal, but there is a sloughing or whatever the expression is.
It would be a pharmaceutical induced.
Okay.
Yeah.
So a number of things are happening. Number one, there's no period, meaning there's no contractility or true squeezing of the uterine lining. Number one. Mm. Number two, there's no period. Number two, there's a hormonal manipulation here. Okay.
Mm-hmm. Yes.
And so now the thing is, because you also talked about the thinning of the hair. So the thinning of the hair can come from a number of different places. Okay, so, from a quote unquote TCM perspective, okay, and I haven't seen her. Okay, so I have no idea, what's, if anything I'm saying is accurate or not. And quite honestly, I don't remember what the advice was last, what we suggested last time, etc. But because it, if we say that the skin is affected by the hormones, which, so there's 3 things that are happening, in terms of symptoms that I'm working with. The main one is the acne on the back. Okay, right? The next one is that the hair is thinning and that she has very cold extremities since she moved to Edinburgh, which sounds like she moved to Edinburgh in order to do this PhD program.
Yeah, so she'd be 3 years there, but she's in England overall 6 years. But I think Edinburgh is up north, so it would be very different to Bristol.
Okay. And how long has she been on this device?
She normally they'd be given it a period of 5 years. I think it's in about 4 years, and this year coming would have been year 5. But she really was very keen. She really wanted it out.
Fair enough. Okay. So in other words, the cold hands and feet started about a year, if I'm doing my calculation correctly, about a year after the IUD was put in.
Yeah, I would say probably, if I was looking at it from a timeline.
In other words, it may have taken time to accumulate. So because the thing is this, hormonal problems can create, the hormones, and I think it's estrogen rather than progesterone, but I could be wrong. This is it's not quite my field. This is, this is Camille's field. I don't, but they do affect the contractility of the blood vessels. So it's common for women who have hormonal issues to have cold extremities. So it can appear like Raynaud's, even though it isn't.
Yeah, I know what you mean, yeah.
Okay? So it's not all that uncommon. So we can say, okay, let's put her in the hormonal category. Now, the other thing, the thinning of the hair, could come from a number of different places. The first one is, I would look into, is there something going on with our thyroid? Okay, because what happens is once you start manipulating one hormone, is it possible that another hormone, starts getting screwed up also? Is it because the pituitary?
Bloods, but I don't think thyroid showed up.
Okay.
But I'll have to check on that. I'm not certain.
Okay. I mean, quite honestly, because a lot of patients don't have, well, a few things. Number one, the tests are highly controversial. Okay, I mean, especially with thyroid, because thyroid numbers change every decade or so, number one. Number two, if you talk to 3 different people in the medical field, especially if you're talking to, someone who does, say, functional medicine versus someone who does, they're going to get very adamant about what tests are useful and which ones are not. So there's a lot of controversy as to whether just doing T3, T4, TSH is enough to determine thyroid number, to determine the state of your thyroid or not. I would say, generally speaking, so what I do is I just test. By pressure pain, is there something around stomach 9 or the lower SCM? And then I'm going to call it thyroid.
Okay, fair enough.
Good enough. And, so it's just, I mean, you're not writing a diagnosis that you're sending off to the Board of Medicine in Edinburgh afterwards, for someone else to criticize you. You're doing it for yourself to be able to figure out something to work with. Okay. Now that's different than if you are actually going to intervene with some sort of phytochemicals, to do, are you going to prescribe some sort of thyroid medication or something? That's a whole different ballgame. What you're trying to do isn't of that nature. Okay, so it's okay that you can, and I'm just saying it's a possibility, just looking at the possibility that there is a thyroid issue, because, her nervous system, you're saying she's under a lot of pressure, there could be some thyroid issue. The other thing is, from a, so-called pure TCM, whatever pure TCM might mean, we say the thinning of the hair is blood not reaching, which you can take as 2 things. Either there's a deficiency of blood. So again, I don't know her. I can't say, can I justify that it's a blood deficiency kind of thing? But we also say the chung is not, the chung is stuck, which makes sense because something actually stuck the chung. Okay. Someone called Marina decided to manipulate the chung at the bottom, right?
Yeah, sorry, Evie. Oh my God.
No problem.
My phone has gone crazy.
It's okay. So you have a number of things to, a number of different possibilities to work with. You have the hormonal possibility. Okay. You have they don't contradict each other. You have the hormonal possibility. You have the thyroid as an extra option. You have the option of working with a chung, and you have the option of working with nourishing blood.
Mm-hmm.
I am going to suggest that nourishing blood may not be what you want to do currently, and the reason why is precisely because of what Camille suggested, is there's a good chance that the liver isn't cleared. So if you're Now, whenever you're clearing the liver, you do not want to nourish blood to some extent, but you don't want to just build up blood, because the liver holds the blood. So if the liver isn't clear, you get basically, it's like putting wine into a dirty glass. You don't want to drink the wine. Kind of thing. Does that make sense? So the liver, so you want to be careful. Now, it's true that, if you look at all formulas that clear the liver, there is going to be something, whether you in the Chinese medical world, it's the peony and the dangwei that we actually call build blood, or whether in the Western world where you're going to get green things, with like chlorophyll style stuff. But there's going to be some building of blood as you're clearing. It's a standard strategy. You with a liver, you never just drain. You always have to in TCM they say to protect the blood, the liver blood, as you're dredging the liver. So I would look at the hormonal options, and include the thyroid as a possibility. So the hormonal options are your small intestine 3, UB66, UB2, small intestine 13, Sanjar 15 area. Okay. Your thyroid is basically in your kidney, either kidney 3, kidney 7, kidney 10, usually or kidney 9. I usually find that either kidney 9 or kidney 7 are going to do the trick. In terms of releasing the SCM, and then see what that point does for everything else. So as you're testing each one, you're testing the possibility. Oh, it's a hormonal primer. You say, does it release her elbow pain? Totally unrelated. Something that you find, whether you find it in the abdomen or it's a symptom. If it releases something that's unrelated, it suggests that it's one of your major components. Okay. Your stomach chi points can be related to the thyroid also. Okay. And then you have the option. So that was the hormonal and the thyroid. And we talked, okay, the chang is a little bit more complicated. So you basically, you can see what spleen 4 does. You can see what, say, a combination of, say, kidney 11 and kidney 27 does. You press on those and you see what it creates in the body, and see, oh, okay, there really is a chang component here. That's a slightly harder one to test. Okay. Now you have other ways of testing it, of deciding on doing something that will look like a chang treatment is by doing opening points and using spleen 4, pericardium 6, and the favorite pair with that would be gallbladder 41, Sanjar 5, and using it either as an infinity treatment with iron pumping cords or without, and sort of see what that does. So it, you don't have to be a pure chang, a pure blah blah, and you can use combinations of all these things. And then yes, I would definitely check the liver, because acne, ultimately the symptom is acne, okay, which is some sort of accumulated toxicity. So the symptom itself generally comes from the liver. Acne, as opposed to other things, is some pretty much most skin conditions will have something to do with the liver. Sometimes they don't, but generally speaking, it's some sort of, it's the blood not cleansing, even though the skin is supposed to be in the domain of the lungs, but it's generally the things that are rubbed out into the skin will tend, because acne is an eruption. It's not dry skin. Which again, you can blame the liver. Oh, not enough blood, blah 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 blah. But it's definitely it's some sort of toxicity. So you definitely, regardless, you want to clean the liver. So, and I'm sure we talked about kidney 9 and large intestine 15 as a skin combination, also known as detox combination. So that's kind of like the way I what I would say now. The interesting thing is what you're saying is that since she took the coil out, you feel like the muscles have better tonicity. You said something about the muscles feeling.
Yeah, just in general, the muscle looks healthier.
Okay, then it suggests that there's going to be a different interpretations here on how you want to interpret that. But it suggests that once the hormonal manipulation stopped, okay, and that can take a while, by the way. In other words, she stopped 2 months ago, but it can still be another year before things really clear.
Exactly.
Begin with. But since you're saying there seems to be a very quick response to the lack of hormonal manipulation or the now the muscles themselves are also, from a TCM perspective, they're nourished by blood. So it suggests that this hormonal manipulation was creating some sort of inability for the blood to the microcirculation to really happen as it should, and possibly even the quality of what's in the blood to be dirty, in some manner. So it's hard to know which it is. So what I would say is, yeah, I mean, you want to maybe clear the blood, so that's going to be kind of like, do you want to do it with food and supplements? My suggestion would be, do lots of dark leafy greens. And what I mean by that is anything that's spinach and darker.
Yeah, okay.
In other words, lettuce doesn't count. I'm saying that because in America, people think that lettuce is a dark leafy green. So think of the ones that
that's really funny.
It is not funny when patients actually think that.
Yeah.
It's really quite, and then they argue and they say, well, because, there's iceberg lettuce, which is definitely not dark leafy green, and they get that, but they think that some of the other lettuces, so whatever. But the king here, I would say, would be your dandelion greens.
Okay.
Now, nobody wants to just eat dandelion greens, granted. So, there's nothing, kale, chard, collards, there's tons of other greens out there. It's not like, berries nourish the blood. They don't clean the blood very well. They do nourish the blood. So it's definitely worth it. And, obviously, get off as much as you can sugar, simple carbs, blah, blah, blah. I mean, there's no point in detoxifying. This is one of the big issues that people have. Everybody wants to detox. Sounds lovely. Don't you want to be clean? It's like, but, I mean, most people do, but nobody wants to stop the intoxication. And there's no point in detoxifying if you're intoxicating.
Yeah.
So as long as you're doing your sugars and whatever, I don't know what she's doing, there's certain things I don't know enough about, the pastrami's or whatever.
Her diet is good, but she definitely is a sugar addict.
Yeah. So that makes it that much harder. People who are sugar addicts generally may find that eating more protein, like say some nuts or something, might help them for a while. Very few people say it helps forever. I mean, it's like if you're a sugarholic, you're a sugarholic. I mean, it's like an alcoholic. Once a sugarholic, always a sugarholic. You're always going to fight it. You may have better tricks to deal with it, and not get, not go for the Mars bars, like right away. But it's always a struggle. And to consider that, that all carbs, especially simple carbs, but really all carbs, complex carbs also, are going to trigger that, or have a chance of triggering it. So, so I'm saying this as someone who is a sugar craver. If once I start, and what start does not mean sugar. Start can be bread. It doesn't end. It opens up, it just totally opens up the floodgates. The only carbs that I can do without too much risk is oats.
Okay.
And even that's a little iffy for me. Sometimes if, so you just have to, and a lot of people who are sugar cravers find that they do better. And this is controversial advice, but in terms of the sugar, it may be helpful. They do better if they eat every 2 or 3 hours instead of 3 meals a day. So they don't have to eat a lot, You can just eat like an apple or whatever, or some nuts. But they do better often if they're eating a little bit more often, you know.
Okay.
But then people will say, but that's not good because you're not allowing food to fully digest, blah, 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 blah. You know, there's a lot of, you know, there's zillions of different theories on all these things. And I'm definitely not the expert on them. And I certainly don't have a clear opinion about who's right and who's wrong. You know, it's just too complicated. So that's what I would look into. Can I ask you, do you know what her exercise routine or options are?
Yeah, she'd be very involved in fitness. She's a hill walker. She does a lot of outdoor sports. Her muscle tone is excellent. She
Okay.
runs, she walks, so she does a lot of yoga.
Okay, so okay, so because that's this thing about the stuckness of the tongue or the liver, you know, the exercise would help with that. So that's if you know, it's conceivably an important aspect, and it's also important. It allows things to vent out better. So
Sure.
that's not the issue. Okay.
Yeah. Well, look, no, that's a good bit to work with, Avi. I mean, that's good. I mean, I'll have a better idea when she gets home and I'm able to maybe do just a bit more of the abdominal checks on her to see where she is with it now. But that's good. There's a good bit in that. I certainly would be able to get her to work with that a bit more through the diet as well.
And Camille, did you have anything?
Any herbs that would be good that might
Oh
be
my gosh, I
worthwhile?
have a lot. So one thing is, if she's eating a lot of sugar, you need to be on the lookout that she does not develop PCOS, polycystic ovarian
Yeah,
syndrome. Are you familiar with it?
I am. Yeah.
Okay, because the main trigger of that is sweets, and that in combination with the synthetic herbs could the synthetic hormones
Mhm.
could really trigger that to occur. So you have to be on the lookout for that, because again, on the concept that estrogen is the yin on the yin side, this is Jeffrey of like, you have the hormones on one side that are yin hormones, and the hormones that on the other side that are yang hormones. Thyroid and progesterone are yang hormones. They're very directly correlated. So Avi's completely correct when he says you have to be careful about.
And I think we lost Camille.
In the States, we see a huge amount of autoimmune thyroid issues. So you want to test her antibodies, like the TPO antibodies, to see whether that's been triggered. And you want to be on the lookout for symptoms of PCOS, which quite frankly tend to be visual. Sometimes looking at a person's body type and how the body type changes can be even more diagnostic than tests, because it got named PCOS really almost as a misnomer, because there really aren't cysts for a lot of people. It's more this pattern of sugar throwing off the hormones. So you want to check for all of those. I sent you by email a product that I use, and I don't know if you could get it there, but you might be able to get the individual components. And this is what you would use to detoxify her. So the main ingredients, one is calcium glucarate, which is the glucarate promotes a liver process called glucuronidation, and that's what detoxifies a lot of the synthetic hormones. Then there's another one called IC3, which is an abbreviation for indole carbonyl 3, IC3. And then there's another one called DIM. And then another very important ingredient in this formulation is glutathione or NAC, NAC, which is a precursor to glutathione. So getting those in place and getting her properly detoxed, I think, will be an important piece of it. And I really strongly agree with what Avi said about getting the good fats in, because that's what's going to help cure or curb the sugar cravings. So a lot of people who crave sugar are craving sugar because their brain is not satisfied with fats, and we've been so programmed to think fats are bad. But you want to have the good fats, the olive oil, the seeds, the nuts, the avocado. Well, probably don't have avocados in Ireland, do you?
It's a global economy, no problem.
That's just
we don't grow them, but we have them.
Yeah, but getting the good fats, remember that by mass, the brain is 12% fat, and the body's going to be hungry until that 12% is satisfied. So, and it's a precursor to hormones. So that's going to help when she gets the good fats. It's going to help jumpstart her proper hormone production.
Okay.
So those are some thoughts. I could also work with you on regulating the progesterone cycle, because once she comes off of this, she might have some hormonal disruptions, and that's a whole other discussion that unfortunately I don't have time for today, because I have to leave for work in 5 minutes now.
No, that's fine. We can come back to that anyway. We'll see how she gets along.
Right, exactly. So we can do that on a further session, or
exactly.
however that works. Yeah.
But
that's the starting point.
Just before Camille leaves, I would say that this PCOS business, your daughter does not sound like a great candidate, and I'll tell you why. It's not a guarantee. The women who do generally would fall into, well, there's two categories. They'll be either very thin, but generally speaking, they're actually more, they'll be overweight, which doesn't sound like your daughter is.
No, she would be very thin, really.
Okay.
Not anorexic, but she was.
What I had said to qualify was that this could trigger PCOS. So I'm not saying she's like that now, but that you need to be on the lookout like 5 or 10 years from now.
Sure, yeah.
If it weren't otherwise corrected.
Okay. Yeah. The thing is that it's what you want to, when the person who's affected by sugar more clearly, body type wise, will be the person that things are not held to begin with, that the muscle tone is already a little bit sort of on the softer side, though. Now, it doesn't mean it can't happen the other way around, but just generally speaking, I'm just saying, that it's a little, you may not have to like jump on that so quickly.
I understand,
But unfortunately, sugar metabolism affects absolutely everything. Okay, because it's kind of like, it's the most primary thing that happens in the body. I mean, well, maybe it's not the most primary thing, but every cell in the body, it needs sugar. Okay, so if you're not, if it gets supplied, if the whole mechanism of getting that into the cell is disrupted through certain, by consumption of free sugar, quote unquote, then you are disrupting, every mechanism in the body could be disrupted. Okay, so yeah, I mean, sugar is also, it is inflammatory. It is this, it is this, it is this. But yeah, but it's just that some people can tolerate it better. Okay, and it sounds like your daughter might also, let's be honest, she's not 50 years old, so it's a matter of age also. So it's easier when you're younger. So, she's probably tolerating it a lot better. But Camille's right that in 20 years, you don't know how it flips.
Sure. Yeah, no, that's correct.
Does that make sense?
Oh, it does, absolutely.
Well,
I mean, there is a lot to work with there, for sure, yeah.
All right.
Yeah, no, that's really good.
All right.
Thanks
Anything?
very much, Abby. Yeah, it's very good.
Welcome. Anything else?
That was kind of my main.
Hmm?
That was my main quest, really.
Okay.
Today was how really. I mean, I have 1,000
Your
clients
daughter.
that I could do with you on, but
Sorry?
I said I've got about 100 clients that I could do with your help on, Evie, but I mean, I can't even go there.
Oh. But for your daughter, okay.
I know. I'll start with her.
Fair enough.
My God.
Okay. So
We were just discussing a bit earlier, Abby, about pulsing, Ren9 pulse. And I think I recall, but I just wanted to be sure that you said it can extend down to like left stomach 26, 27.
yes, it's okay. The name Ren9 pulse is actually a misnomer because it's not like it's on Ren9. It's around the navel, but it can extend higher. And when it extends higher, it's generally around the Ren line. And it can extend lower from the navel, and it will tend to go more to the left rather than, I'm trying to think. I don't want to sound dogmatic, but someone that it extends to the right is not an obvious one. It's not coming up right away. But lots of people, it's more common, as far as I can remember, that it moves to the left, that you're feeling it on the left. So you can feel it above and below. So think about that. We say Ren9 pulse, but what we really mean is pulsing in the abdomen that's not fluid. Sometimes you get water that's pulsing. That's different. That can be anywhere in the abdomen. It's not very common, at least that I've seen. But we're talking about a pulse that's a vessel. That's a pulse. Like this kind of pulse. That sort of pulsing in the abdomen, pretty much anywhere, but it's going to be generally somewhere around the navel and somewhere within the vicinity of the center. It's, I don't recall anybody with, say, going to go about a 26 and finding a pulse there. Okay, that's just not my recollection. I think I would remember. I mean, that's extremely rare. Whereas the pulsing around the navel, give or take inches, is quite common. So yeah, don't worry that it's Ren9 or not Ren9.
Okay.
Worry that when you're placing your hand on the abdomen, you're going to feel it. And because I still, even though I don't use Oketsu personally, that's one of the first things that I check, just because it's part of my routine, and it's also part of the way for me to get them used to my touch. Okay, so usually, like totally first time patient, I go for like spleen line, say spleen 12, spleen 13, 14, and check that first, because most people don't have anything there. Sometimes I can already there tell that there's a pulse in the abdomen. It's often a little bit fainter. And then when I go for left stomach 26, 27, so I give that to them as a baseline. This is what my fingers feel like. And then I start checking, but because I'm not that interested in Oketsu, some people think that's heresy, but that's just what I do. It's another chance for them to kind of like get used to my fingers, to how my hands feel. And then I go for right sides 26, 27, and I can give them a comparison. So usually often when they have a pulse, I may already feel it at left stomach 26, 27.
Right. Yeah.
And then if I'm checking adrenal below kidney 16, I will feel it. So that's, yes, I will feel it on Ren9 as well, but it's often not just, it's kind of unusual for someone to have it only on Ren9. If they have it, chances are I will feel it on just below kidney 16 also, in all likelihood.
Okay. Yeah.
Does that help?
Yeah, no, that answers it, yeah.
And the other area I was wondering about, Abby, is the upper back. Like we say, somebody with pressure pain across the upper back, thoracic.
Between
maybe
the
like
shoulder blades?
maybe a bit lower,
A bit lower, meaning like level
kind of,
with
say T7 to T12, maybe, you know, that kind of area.
okay, that would generally be considered sugar as a
Oh,
dogma.
okay.
As a dogma. So remember, that may not be totally true because there could be, I mean, this could be someone with scoliosis, could be. So I would treat sugar, which kind of like unfortunately gets you to T12 on the other side, but on, you know, when you're on the back, but when you're on the front, you get your spleen 3, you get your you know, OD sphincter point, right stomach 22. So you do what you can with that. On the back, I would start with sacroiliac ligaments. And then this is the unfortunate part, because the continuation of the sugar is the T11, T12, which is kind of, well, they probably don't have a spasm exactly at T11, T12 plateau, but just next to it, they have a spasm. So it's often difficult to needle, and it might be very tight there. It may not be so easy to needle.
This was more kind of running across the back, you know, like not concentrated towards the spine or anything.
Okay, so across the back, well, the thing is, you said T7 to T12, so that gave me 2 very large areas. So it gives me the impression of going, you know, of the paraspinals. So it's not the paraspinals.
No, it was more like a lateral.
Okay, like a beam
Yeah.
across. Now,
Yeah.
so now if you could be a teeny bit more specific about between T7 to T12, because it's a little bit too large an area.
Well, more upwards than downwards, more towards the T7.
Okay, and how wide? How wide? So they have a belt. Let's say we'll call it T10, just for the sake of it. Okay, well, it doesn't matter. And is the band about 1 vertebrae's width?
Maybe 2.
2. Okay, so it's about 2 inches wide. Okay. Huh. What, anything else in the medical history?
Not a whole lot. Usually shows adrenal reflux.
Forget that. Let's talk about the medical. Well, okay, adrenal reflex. Okay, let's talk about the actual medical history.
No, nothing much in the medical history.
And they're coming for this. They're coming for this back pain, this back spasm, or whatever.
Well, digestive problems and this back pain has manifested kind of at the same time.
Okay. I would suggest, in which case, that this back thing is a result of the digestion. I would concentrate on dealing with it now. So what kind of digestive issues? Are they pancreatic type issues? Enzymes, or what's the issue with what is the digestion issue?
Well, just I suppose generally would be like slow metabolism and certain foods.
Allergies?
You know, not so much allergies now, but mostly when this person, like say, eats out away from home, just some maybe sedatives, I don't know, triggers kind of like a nausea.
Okay, so some foods produce nausea. When you say slow digestion, are you saying something close to constipation?
Yeah, tending towards constipation.
And bloating?
Bloating, yeah. And the bloating under the ribs, kind of.
Okay. I would say, now, does she have a beam across, you know, stomach 21s?
No, no, I don't.
Does it feel a little tender, puffy, different than the other tissue?
Not really, no.
Okay. Any history of gallbladder issues in the family?
No.
Okay.
No.
Even though you can't call this, you know, it wouldn't be called sugar, but I would still treat it as if it's sugar, because basically what I mean, it sounds like there's some sphincter issues going on. Okay, and I can't fully justify that, so the thing is, so she has foods and she has nausea, that's an upper sphincter, and then she, it sounds like because of the slow transit time and the bloating can happen from a number of different factors. One of them is that the enzyme, the pancreas is not releasing enough enzymes. Okay, another is an over fermentation in the small intestine itself, granted, but so it's always hard to know exactly where bloating, bloating can come from different places. And then, so it's going to be a little hard to evaluate, but, since, so the pancreas part is spleen 3, I would look at spleen 3 plus pericardium, okay, because the upper sphincter belongs more in the spleen 3 and pericardium, whereas the lower sphincter belongs more in spleen 3. And I would do Sanjiao 8, releasing the SCM to release sphincters. See what that does. And the other thing is, you can ask her maybe to do some digestive enzymes before she eats, in whatever form, whether you actually buy enzymes, you eat papaya or papaya seed before, there's not different ways to do digestive enzymes. It doesn't always have to come as a product. And see if that improves the digestion, and ask her to drink a little bit of warm water, especially when she is away, before she eats. Anyone who gets any sort of heartburn, nausea, it often helps to not eat right away, don't eat on a dry esophagus, quote unquote. Smooth out the esophagus, prepare it, with warm, and it has to be warm. Okay, it doesn't have to be boiling hot tea. That's probably not such a great idea, but warm water, above room temperature, but not boiling. And, just a few sips, and then eat, and see if that helps. And I would look into, experimenting with digestive enzymes and see if that helps. So, because it does sound like both the location and even the symptom, muscle spasms, muscle contracture, it can be related to digestion, and specifically sugar, but digestion in general as well. So, and in her case, it is. So, does that make sense?
Yeah. Yeah. That's great. Thanks, Sylvie.
All right. Anything else?
Nearer
no,
time.
nothing that springs to mind, Evie, no.
All right. All right. Well, enjoy the rest of your day and your trip back.
And my journey back.
2 hours. And we'll talk on December 6th, it looks like.
December 6th.
Oh.
Okay. No, that's great, Evie. Thanks for that. That's very helpful.
You are most welcome.
Yes.
All right.
All right. Take care.
Thanks,
So,
Evie.
All right.
Thank you.
Thanks.
bye. Bye.
Bye. Bye.
Bye.